the bottom.
So, hi everyone, we are Group 5. My team members are myself, Adeline, Rachel, Ignatius, and Joel. Today we are presenting to you our per age care home research. Next. Our agenda for today are introduction, research aim, objective and question, research framework, methodology, quantitative and qualitative result, discussion, and lastly recommendation. Next please. A brief record on our research are Per Aged Care provide premium healthcare and residential facility to elderly residents in Australia. In view of the COVID-19 pandemic, we would like to obtain insight into providing quality of care for its elderly residents while achieving long-term business sustainability. As the consultancy team engaged for this research project, we study the feasibility of per aged care mandate and present our research finding with prospect recommendation as follows. Next, please. Our research aim was to gain an understanding of factors that can affect the perceived quality of healthcare in aged care, home and business accessibility. The research objectives are as follows. Firstly, to identify specific physical resources and psychological factors that can influence the perceived quality of healthcare in aged care homes. Secondly, to investigate how the perceived value of qualitative healthcare can influence the customer willingness to pay more, which impact business activity. The research objective leads us to formulate the following research questions. The first question is, what physical resources factor will likely influence the perceived qualitative of healthcare in aged care home and to what extent? Second, what internal and external psychological factor will likely influence the perceived qualitative of healthcare in aged care home and to what extent? Lastly, is the perceived value in qualitative healthcare likely to influence the customer willingness to pay more for qualitative healthcare which impact business sustainability? I will pass my time over to Ignatius.
Okay, thanks, Adeline. So basically, the research framework here is that we came out with this dependent variable based on our client's request. So what we are interested in is the quality of healthcare in aged home care. And then the independent variable which we want to test revolves around the competence level of healthcare workers, the effect of family members' feedback, and as well as the mental well-being of elderly on healthcare quality. So we have 3 independent variables and 3 hypotheses that we want to test. The reason why we have perceived upfront is because how we got the survey was based on our general population, basically our friends and our families, to do the survey. Yeah. So in terms of methodology, right, what the team took on was the exploratory sequential mixed method research. So basically the whole idea was to get both quantitative and qualitative data so that it can address the advantages and disadvantages of each method alone. So in quantitative data, what we got is we got a survey. We did a survey questionnaire, and then we got 62 respondents to do the survey. And then once with the survey results, we analyzed, and then we crafted our qualitative interview questions based on our quantitative data as far as the research questions that we want to address. So for our qualitative questions, we have 5 interviews. So once we have both qualitative and quantitative, we combine and merge and integrate the data to address the research questions. In view of time constraint as well as cost considerations, the team did convenience sampling for this research. So our research demographics, basically, in terms of gender, we have quite a fair split between male and female. Age group, the majority, slightly over 50%, is between the age of 18 and 30 years old. Monthly income-wise, we are looking at the bulk of respondents earning between 2,000 to 5,000 per month. Education level-wise, we also have we see a split of a fair split of diploma and bachelor's degree holders. Yeah, so I think what we want to bring to attention is that we want to see like how many of our respondents have some experience or relations in aged care homes. So as you can see, it's expected that the bulk of it will have no relation, and then 24 respondents have some sort of relation to experience with aged care home. Okay. Next, so we tabulated the results, and then for our three hypotheses, the results was quite conclusive. So basically, in terms of the t-test p-value, we are getting what we call statistically significant value, which is less than 0.05 or 95%, above 95% confidence level. And all three hypotheses proves to have a moderate positive correlation. So it sets us in the right direction of how we are doing the research. So we are focusing on the competence of the staff, the family members' feedback, and as well as the mental well-being of the elderly. Yeah. Next, I'll pass on to Joel.
Okay, thank you, Ignatius. Okay, so as mentioned by Ignatius, just now, we have actually interviewed 5 respondents for our qualitative survey. So for the demographics of the qualitative survey, we have the youngest being 24 years old to the oldest of 32 years old. And for their annual income range is around 40,000 to 50,000, with respondents A and E being at zero income due to them being still students or either not found a job yet. And as for educational level of the interviewees, 60% of them are diploma holders, while the remaining 40% are bachelor degree holders. Yeah, next. Okay, so the qualitative, we have actually done the qualitative interviews, and through transcribing it and coding it, we have come up with mainly 4 teams to support. The first team being mental well-being, second team being quality-based pricing, and next. Ignatius. Okay, and next being the facilities and the environment, and lastly, staff responsibilities. Next. Okay, so with through the results, we have found similarities. So to start off, we have respondents who are willing to pay for more quality healthcare, which means the money that they pay for have to equate the healthcare service that they are getting. And secondly, the feedback of the family members can affect the quality of the healthcare provided. With more feedbacks, the staff in the aged care home can improve themselves to give better quality service. And thirdly, the mental well-being of the elderly can actually impact the impression of the quality of the aged care homes. Okay, and fourth, facilities and environments of aged care homes actually affects the perceived quality of healthcare. And lastly, the staff of the aged care home is impactful to the perceived quality of healthcare. Okay, next. Okay, so this is the model of the factors affecting the quality of healthcare services, mainly customer-related, provider-related, organizational, and environment factors. So, for example, organizational factors like having good organizational welfare and customers giving good feedbacks. These are actually positive factors that translates positively to the provider and giving them satisfaction. With this satisfaction, it actually helps them to be more competent in their job, eventually improving themselves to give better services to the patients, and this will lead to eventual patient satisfaction. Okay, so I'll move on. I'll hand on to Rachel for the remaining segment. Yeah, thank you.
Okay, thank you, Joel. So I'll be discussing about relating it back to our research question. So our research question 1 is, what physical resource factor will likely influence the perceived quality of healthcare at an old age home, and to what extent? So the main factors we have found out that quality, because of its subjective nature and intangible characteristics, is difficult to define. So factors such as availability of resources, patient cooperation, and collaboration amongst providers affect the quality of medical service and patient outcomes. Supportive leadership and proper planning, education and training, and effective management of resources and process improve the quality of medical services. So the four main one would be availability of resources, patient cooperation and collaboration, environment of the home, and location of the home. Going to our research question 2, what internal and external physiological factors will likely influence the perceived quality of healthcare in each home, and to what extent? So some internal factors include our patient's age, and the patient's qualification. This actually backed up by our secondary data, which actually depicts that the relationship between the patient education and the quality of a surgical nursing care, as perceived by data in 2019, it depicts a positive correlation between the perceived quality of surgical nursing care and received knowledge was strong, suggesting that a positive relation between patient education and improve the quality of nursing care. So some external factors includes the waiting room of a home, and then the clinical support staff and the attitude of their staff. This is also backed up by another study done in 20,000, showing that the design of the doctor's waiting room influenced the patient's perceptions of quality of care delivered by the doctors. So going to research question 3, is the perceived value in quality healthcare likely to influence the customer's willingness to pay more? So a study that shows especially higher reputation has a higher perceived service quality, which can contribute to a perceived service value, therefore more satisfied questions. So patients are willing to pay more if they are satisfaction with 3 attributes of care. And these 3 attributes are closer doctor-patient relationship, increased drug availability, increased chances of recovery, and the doctor-patient relationship is considered most important by patients and exhibits the highest willingness to pay. So going to the next slide. So some limitations of our mixed method research is it's very time consuming, labor intensive, and majority of our respondents are not direct consumers because they are general public so they are not direct consumers of aged home care. The responses they provided cannot be generalized, and the respondents are all based in Singapore. Next. And for that, we have some recommendations. We have grouped the recommendations in 4 points: staff competence, family feedback, mental well-being, quality-based. So qualified healthcare staff with proper training to take care of aged care, and also management should be open to feedback of family. So family feedback should always be able to improve the quality of the aged care as a whole. So mental well-being is also one of our priorities, as feedback from the respondents that is actually one of the utmost important factors when it comes to putting their family into an aged home. And also quality-based pricing. So if the price of the service can be justified by the quality of a service, most patients will be willing to pay. So next, with that, we end our presentation. These are references. And this is the team members' contribution.
All right, thank you. You can pause the recording.
All right, thank you.